All right, today I'm going to be talking about driver rehabilitation and how some healthcare professionals such as ourselves can possibly help individuals. We were hoping to have some driver rehabilitation specialists come and speak to you directly about what services they provide. They were a great help in putting this PowerPoint together. But I also want you to know that I found some really good common resources, evaluations, assessments directly in your Bonder book. And so those would be very, very helpful if you find yourself in this type of a setting, in this type of a role. Some learning objectives. I want you to be able to analyze the physical and cognitive functions as they relate to driving. And then I'd like you to identify appropriate driving rehab recommendations for individuals with both a physical and a cognitive impairment. And we'll kind of look at some of those. If you notice that some of that terminology is similar or familiar, you'll know that's directly relating back to our assignment, where our community mobility assignment, where half is geared towards accessing or assessing public transportation, but the other half is just simply assessing your own personal vehicle. And so this is that component, driver rehab is that component for people who may have some type of impairment, whether it's be physical or cognitive, and how we may be able to add some adaptive devices or do some thorough testing or referring on to a specialist to determine if they're able to safely be behind a wheel. Now, when we look at activities of daily living, our basic activities of daily living, feeding ourselves, dressing, grooming, bathing, going to the bathroom, those kinds of things. As we move up the pyramid, they become more complicated and more advanced. And so you can see at the very top, we have mobility, which would be moving around in our community, which would include transportation, which would include that personal transportation, as well as maybe using public transportation as well. So when I talk about complexities, just looking at driving functions and how each extremity, our left upper extremity, right upper extremity, left lower extremity, right lower extremity, when we're looking at the complex task of driving, each one of those extremities has a great deal of things or functions that they should be able to do. So just for example, both left and right upper extremity are of course used for steering. We may be using our left upper extremity to fasten our seatbelt, right? Our right upper extremity may be reaching across our midline to grab the seatbelt, or we may just simply do that with our left. Our right upper extremity may be using temperature controls, radio controls, depending on where your wipers are at. Maybe your left upper extremity is dimming and brightening your lights, using the tilt steering on your driving column, maybe opening and closing the doors, locking the doors, adjusting the windows. You get the idea. The left lower extremity is looking at maybe assisting with your sitting balance or assisting with your manual seat adjustments. And so I know in one of my vehicles, I have to reach below with my right upper extremity and pull a lever, and then I use my lower extremities to kind of scoot myself forward or backwards. It just sort of depends. Your left lower extremity can be used also if you have a clutch in your vehicle or just simply applying your parking brake. Now your right lower extremity operates both the accelerator and the brake, and so that can kind of be important if you have a right lower extremity surgery where you can't weight bear, those kinds of things. It becomes quite tricky. So when we're looking at the clinical aspects of returning back to driving, we need to look at all of those physical skills that go into driving. We may have to look at how mobile we are already. So are we wheelchair bound? Are we ambulatory? Vision and visual perception is a really big piece of the puzzle also. Um, Cognition is a very important part of driving. Medical issues or certain restrictions, and so sometimes there are certain medications that are prescribed where there is a driving is contraindicated. Also, if there's certain surgical procedures that happen and somebody's non-weight bearing, um, particularly I'm thinking of that right lower extremity. There may be some contraindications to driving with that right lower extremity as well. Um, let's see here. Seizures are also would also go against driving and would be driving would be contraindicated as well. And I'll be going over some of the laws, particularly in North Dakota, that particularly affects. We may be looking at psychological aspects as well of a person, if they're more inclined to road rage, those kinds of things to where they would be unsafe, but also looking at legal considerations as well. And so um, I'm thinking of seizures in the policies that are in place for seizures. Um, if somebody gets behind a wheel and they knowingly have seizures and they're not medically controlled, um, that could put them at risk for some legal considerations as well. And so it's important to know what the legalities are in each state. When we're looking at physical skills, we're looking at our range of motion. We're looking at, do we have enough strength or manual muscle testing? Do we have the coordination? Do we have the sensory skills needed? Do we have the trunk head control? Not just dynamically moving, but being able to statically uphold that posture and have the overall endurance for that posture. So certainly when somebody has a physical impairment, some of the things that they would have difficult with would just simply be getting in and out of their vehicle, right? If you go back and you look at all of the clinical skills needed to drive, you can kind of get a picture of what would occur if somebody had a physical impairment. So getting in and out, if they have a physical impairment of their right upper extremity, how would they get their windshield wipers on and off? Would they be able to access their radio? Would they be able to shift? Um, would they be able to put their vehicle in park or drive, reverse, all of those kinds of things. If their left upper extremity is affected, would they be able to turn on their blinker? Would they be able to steer their steering wheel? Again, lower extremities, would they be able to accelerate? Would they be able to brake? Um, how would those things look? And how would they be relating to somebody with a physical impairment? Okay, that kind of lends itself nicely to our assignment, our driver rehab assignment, right? And so thinking about a particular physical impairment of maybe a leg fracture or somebody's in a cast or somebody has a spinal cord injury, not being able to have the strength, the range of motion, the coordination to steer the wheel. Okay, if that's the case, what adaptive equipment could be placed on the steering wheel or on the brake, on the accelerator, that could be used to help somebody access their own vehicle? And so I'll be taking a look at some adaptive devices and pieces that could be included in your vehicle to allow somebody to have access to use their vehicle with decreased physical skills. Again, adaptive equipment, adaptive devices can be anything relating to steering to help with steering. It may be more hand controls, just shifting a control from one side to the other. So if you only have access with your right hand, you can use your right hand. Having a left foot accelerator. And so if you can't weight bear on your right leg, there's a left foot or there's an attachment that can be added so that your left foot can do the accelerating instead. There's all kinds of different mirrors that could go in place to kind of, if you have decreased range of motion or trunk rotation, neck range of motion, just to give you a little more viewpoints to look behind you, to look for blind spots. There could be adaptive devices for any secondary controls as well, for any positioning devices. Perhaps there's lifts that can be added to your vehicle to help somebody lift into their driver's seat. Maybe a loading device such as a ramp or a lift to load your wheelchair or scooter or any of those kinds of things into the vehicle. There are so many other ones or other pieces of adaptive equipment out there. Just by doing Google searches and those sorts of things, you can really find a lot of different devices that are out there that could be very helpful. When we're considering mobility, again, we're looking for ambulation. Are they ambulatory? If so, do they require the use of a front-wheeled walker? Okay. When they're getting in and out of their vehicle, we have to be able to assess how they transfer, right? Can they access their vehicle? If they can't access their vehicle to get in and out, that may be challenging. When we're looking at and assessing mobility also, do they have the endurance and the capacity to sit in their vehicle for however length of time? But do they have the endurance also to tolerate accessing their overall community? When we're assessing their mobility, whether they're ambulatory, whether they're in a wheelchair, a electric mobility device, are they dependent on transfers? Can they independently transfer? This may lend itself to even identifying what particular vehicle could be used or should be used, and what devices can be modified to a vehicle or added to a vehicle to help them with their transfer or help them with their overall assessing their vehicle. When we're looking for wheelchair use, again, it may impact what vehicle they choose or what device needs to be added to their vehicle, depending on, do they have a manual wheelchair? Do they have a power wheelchair or an overall scooter? So there are some devices, such as a wheelchair ramp, right, that that could be installed in certain types of vehicles. I'm thinking of a van in particular. I've known some people who have had lifts in pickup trucks. And so they're able to get into their pickup truck, but then they have sort of a device that picks up their wheelchair and transfers it into the back of their truck independently, almost as though it was a crane, those sorts of things. And so there's many different options out there. It's just becoming well versed in what options are out there. And that's going to depend on, again, what your client uses. Is it a manual wheelchair? Is it a power wheelchair? I've also had some clients who have been in manual wheelchairs. They transfer independently to a car. From sitting in a car, they can fold up their wheelchair and they can simply toss it into the back of their car as well. It's not an easy sight, but it's something that that works for them and gets them on the road and gets them mobile and accessing their community. If they are in a wheelchair, we may need to consider doing a wheelchair assessment also. Again, they may come with a wheelchair and be looking at progressing to driving, those kinds of things. And so looking at maybe what formal wheelchair assessment has been done can be important too. So whether we're the ones doing the wheelchair assessment and following through to driver rehab, or we're driver rehab and somebody's already done a wheelchair assessment, we need to carefully look at what assessment had been completed. So when we're doing that, we need to analyze what the client is using their wheelchair for. Okay, so if it's an electric wheelchair, is it moving about the community? Is it moving about their home? Is it moving about the grocery store? All of those kinds of things. So what are they using it for? What are their chair skills? And so can they manually move their chair? Can they use their upper extremities to fold up the chair and to toss it in the back of the car or the pickup? Can they maneuver their chair manually? Is their chair appropriate for their needs as well as their body size? Does their current wheelchair allow for good posture? What are some of the features of their wheelchair? Okay, and so are they mobile? Do they fold up? Are they lightweight? Do they have side supports to maybe help with any positioning, or help with any positioning, to help with any um, weight shifting, to help with any endurance, any of those kinds of things? Would their wheelchair be able to interface with their vehicle? Okay, so some of the pictures I show you, I will show you that if a wheelchair is used to access the driving column, the shifting, all of those kinds of things, the chair is going to have to be strapped in, or it's going to have to enter an interface column to where it safely locks into place. Okay. It's important to know that when doing a wheelchair assessment, you absolutely need a measuring tape um, to know the depth, the width of the wheelchair, not just for the client to sit, but also the width of the wheelchair as it relates to accessing and fitting into spaces behind the steering wheel or in the back seat of the car or any of those kinds of things. And so they do have wheelchair clinics available. Talking with your wheelchair vendors, also your Great Plains rehab specialists, those kinds of things. So if you know that a person is going to need a wheelchair and that person is hoping to be more independent with driving their own vehicle or modified vehicle, and we know that from the start, we may be wanting to recommend and use wheelchairs that may be compatible for driver rehab right from the get-go. I worked in a community where we did not have a wheelchair clinic. I was the wheelchair clinic, and I worked very closely with our rehab company that was right there in our community. And so if I knew somebody was going to be needing a wheelchair and they were hoping to use driver or go into a driver rehab program, I would be asking my wheelchair vendor and having that communication with them. I also, since I was not a driver rehab specialist, and we had specialists in our state, in Bismarck and Fargo, I would give them a call and I would say, hey, I'm looking at a wheelchair, or looking at fitting a client to a wheelchair. I'm working with a local vendor here. Can we all touch base together and identify what wheelchair may be most appropriate in getting them into a driver rehab type of a simulated vehicle or a car, or what are some of the options out there? And so I remember making some calls to some wheelchair or to some driver rehab specialists and just getting their input, and going from there. We've actually had some of the driver rehab specialists come to our rehab facility, which was about 2 hours away, just to kind of share what they were looking for, what was a good fit, what was a good referral to their program, so I could refer on if needed. When we look at ADL or IADL considerations, we're looking also, are people needing caregiver assistance? Can we rely on caregiver assistance if needed, or family assistance if needed? Are we in need of car seats? And so there's some individuals that I've worked with who have been mothers, fathers, who have needed or who have been in wheelchairs and have needed to get their children to and from appointments. And so can they access their children's car seats if they're themselves in a wheelchair? Looking at employment needs, as well. Um, can they get to and from work? Those kinds of things with an adapted vehicle, anything relating to that. Any personal needs as well, relating to household, any medical needs. This is important. Rural versus urban driving. I've worked with people with traumatic brain injuries who cognitively should not be driving. However, the physician had okayed it because they lived in a very rural area, and they would not be doing any urban driving. How they controlled that, how they made that recommendation, I do not know. It was somewhat concerning to those of us who worked in that rehab department at that time. But nonetheless, that's something that we consider when we're looking at all ADLs and IADLs, right? If they're moving into a driver rehab type of a program, looking at any driver's license restrictions they may already have. So if they have seizures, if they have lenses, if they have any adaptive devices that are needed for their driver's license or for their driving, there may be restrictions placed on their driver's license. Weather-related conditions may also be considerations for ADLs, IADLs, for transportation. Certainly if you are driving on ice, you need to have just a little bit different response speed, right? And so maybe the recommendation would be to avoid inclemental weather conditions such as icy roads, wet roads, those kinds of things. Those are all good things to kind of keep in mind. As I mentioned before, you can have visual restrictions placed on your driver's license, and I had contact lenses, and so there was a restriction on my driver's license for many years, and it just basically stated that I needed to have I needed to be wearing my contact lenses or glasses when driving. So if I were to get pulled over for a citation, and I didn't have my glasses on or something like that, I could be given further citations for that. And so when going for a driver's license, again, you would have your visual acuity test, making sure that you have visual fields, making sure that you have contrast sensitivity, all of those things. And they do a lot of those testings right at the Department of Transportation when you're applying for your license. So again, you'd want to make sure that you're meeting the state visual requirements as well. As OTs, we get a little bit deeper into visual perception. And so there's many different standardized assessments for visual perception. There's a visual perception frame of reference with all kinds of different visual perception terminology like figure ground, depth perception, contrast, just different visual perception types of terminology and functions. So um, certainly we can do some clinical observations just by watching your client functionally do things um, around the house, with dressing, with housekeeping, those kinds of things. We could do formal testing as well. And it's always good to refer on to an optometrist or even an ophthalmologist if you're noticing some issues with visual perception. And just know that that would have a pretty significant impact on somebody's driving as well. Medical issues, restrictions, we talked about some of these already. So if you have post-surgical restrictions, maybe weight bearing, obviously you're not going to be able to press down on the accelerator or brake if you have that non-weight bearing precaution. Any medications, also prescription medications, maybe non-prescription or recreational medications. If you have any uncontrolled medical conditions such as diabetes or seizures, again, there's specific policies in place state by state on maybe certain medical conditions that would restrict your ability to drive. When assessing cognition, looking at your overall attention span, your ability to follow directions, your ability to make safe decisions, your overall memory, problem solving, again, safety judgment, and those advanced executive functioning skills as well. And so anytime we're kind of questioning, is somebody not safe driving? They physically have the capability of it, but man, they do not have an adequate attention span, or they can't follow directions. How are they going to get anywhere? Or what happens if they get lost? Are they going to be able to problem solve that? And again, overall safety could be an issue as well. So cognition is a very important piece. And again, when we were looking at your assignment, is there anything, if somebody has a memory deficit, um, there are just regular things in a regular vehicle nowadays that may be able to help your memory, right? And so it could be a simple recommendation that you make for somebody with a memory impairment or a short-term memory impairment to write down the list of things they need to do before they go, to use Google Maps, or to use, gosh, there's lots of things like voice memos and those kinds of things on your cell phone now. I mean, you are probably all more well adept at that than I am. Let's see here. For just some other cognition issues, just looking at, using, I'm drawing a blank, but just plugging in your address and using your GPS, those kinds of things. I mean, again, you guys are probably well adept at some of those simple things. Now, sometimes people have a little bit different or a little bit more severe cognitive impairment. That gentleman that had a traumatic brain injury had absolutely no safety awareness whatsoever. He would just say, yeah, the doctor told me I shouldn't be driving for this many weeks. Well, I'm not going to follow that because a man's got to do what a man's got to do. And he was referring to going and getting groceries and running errands, and I'm going to go to the bar, and I'm going to, hang out with my friends, and then I'm going to get in my car and I'm going to drive home. And there just was no awareness about, okay, I already have a traumatic brain injury. I've been told by my doctor I shouldn't be driving for so many weeks, and then we'll reassess. And then now I'm going to go to a bar to hang out with my friends, and I'm going to probably drink, and I'm not going to care. I'm going to, or know when to stop. I'm going to just get in my car and drive home. To me, when saying those things, it was a really significant safety issue, right? And so, I mean, that's a very obvious kind of a situation, but But sometimes you may be kind of curious, okay, this person has Alzheimer's or early stages of Alzheimer's or dementia, and they're oftentimes leaving their house to go get the mail, and they're getting lost and they're freaking out and they're not recognizing anybody. Okay, and so for some of those more severe cases, like, oh my goodness, a voice memo or those kinds of things aren't probably going to do the trick, and we have to be very conservative about what our recommendations might be for driver rehab, right? And looking at, okay, is there a rehab potential to get better, or is this an ongoing condition that's going to gradually get worse? Maybe we need to consider some alternatives to personal driving, such as relying on family or relying on delivery services, right? Or, I mean, you can call, supermarkets now, and you can have them, you can fill everything out online and have them delivered. Um, and so even if it's caregiver assistance, right? And there's caregiver assistance to do the shopping for them and bring it there for them, or to take them, somebody familiar to take them to run an errand, maybe every week or every other week or something along those lines, so that they're not getting behind the wheel if they're unable to make decisions, if they're unable to follow directions, if they're unable to problem solve when they're in an unfamiliar type of situation, maybe even because of their memory. So be thinking about that with your assignment. And I gave you some ideas there in just now. And so hopefully that helps spin your wheels a little bit for you to come up with some creative strategies for your assignment, your driver rehab assignment. So also looking at cognition, what's your overall interpretation of driving situations? And so I might show some samples or some examples to individuals and say, can you name the unsafe situation here? And if somebody can walk me through it, or if they can't walk me through it, right? That may be sort of a cue that they may be unsafe. That gentleman I told you about, just him rambling on about his plans, right? And when I say, hey, that goes against your doctor's orders, like I don't think that's a very good idea. And just hearing his response about that kind of tells me, oh, he's not in a very safe minded place right now, probably because of his diagnosis. There's many different evaluations, standardized evaluations that you can use. There's the brief cognitive assessment tool. There's the MEMS, the Middlesex Elderly Assessment of Mental State. That one's been compared to the mini mental. You guys know what the slums is. There's also the short blessed test. That's a short cognitive assessment that's similar to the mini mental. You can get more neuropsychological testing that goes really, really, really in depth, usually done by a neurologist, psychologist, somewhere along those lines, and just simply doing some functional observation or clinical observation as well. Okay, that gentleman who came in with the TBI that shouldn't have been driving, drove his pickup, hit one of our little curb stops, right? Went right over it, almost hit our building. And so clearly that was an observation we made where he did not have the response speed enough to brake in time and didn't think anything of it. Also, just running through with your clients, just pictures of traffic signs and just seeing what they know and if they remember what some of those traffic signs mean. Those are some real simple screenings that you could simply do, even if you're not a driver rehab specialist, but just knowing your client wants to get back to driving and you're really questioning whether or not they can, it's something that you could simply do and assess. So if you're looking at a driving specific assessment, now there's some driving specific assessment in your reading assignment, so be sure to look at that. The ones the driver rehab specialist pointed me to was the OT DORA battery. And that's an assessment that efficiently assesses cognition, perception, behavior, their physical sense, sensory skills, and abilities relating to driving. And so all of this assessment is done prior to your on-road assessment, okay? So sometimes we could do this part of our assessment even before they're referred to a driver specialist, right? Or if we did any visual perception or range of motion or strength testing, any of those things, and then we know that they're going to move to a driver rehab specialist, you'll likely want to share those results of all of those different assessments with your driver rehab specialist. So you're doing this particular battery gives you the ability to screen an individual if they're completely unsafe, right? And you kind of have to go. So if you're a driver rehab specialist, then and you take a look at this particular battery, you would say, hey, I think they're ready for an on-road assessment. So this battery really helps you kind of problem solve and screen out those people who would not be safe at all, or perhaps gives you some strategies on, you know what, let's really target that visual perception in our OT interventions. Let's really target our upper extremity range of motion and strength. Let's really target the use of our prosthetic device before we take them on that on-road assessment. So again, it pinpoints any strengths or weaknesses which we could focus on and include just in our regular outpatient or inpatient for that matter, rehabilitation setting or OT intervention, okay, before, and we can kind of rehabilitate those underlying skills before we have somebody take them on an open road assessment. So here's a picture. I'm going to go through some pictures rather quickly. Here's a picture of one of the adapted vehicles at Sanford here in Bismarck. It's all decked out with the different devices inside. And so this would be the car that they would take to assess on the road. Just some different devices here that are commonly used to help with steering. Here's a spinner knob. So it's just a knob that is added to the steering wheel. So if somebody only has one use of one arm, they can use that spinner knob to completely turn their steering wheel. This one is a tri-pin spinner knob. And so this is somebody perhaps who has that tenodesis grasp, right? And so, or maybe they have weak wrist extensors or flexors. And so this would position their wrist and their hand so they could use their shoulder, more of their shoulder, and have some stability in their wrist and hand to be making those turns with that steering wheel. This one is just a single spin or single pin spinner knob. And so again, if for some reason somebody prefers to grasp instead of using the knob, right, this would be another option for them. I think of a really old international pickup my grandfather had, and I remember one of my memories I have of him with him and my dad. We were riding around, obviously no car seats in a vehicle that old. And he actually had one of those spinner knobs. It just came standard back then with the old international pickups. And so I remember like him holding onto that knob and going back and forth like crazy with the steering wheel. And we were going really fast and we were in the country, of course, and we were hitting snowbanks and just having a great old time. And so whenever I see the spinner knob, I always think how, oh wow, that used to come standard and now it's something that people need to include. Again, this is just another picture of the single pin spinner knob. Again, just a little bit different take on the picture, a little bit better view. This is a V-grip spinner knob, kind of a close-up. So again, doesn't provide as much stability for somebody with tenodesis, perhaps, but if they have some of that ulnar stability and they're able to wedge their hand in there, perhaps they could use that to steer as well. So there are many, many, many options if you're having trouble gripping a steering wheel. This one's interesting. This one's an amputee ring steering spinning knob, and so there's just a little hole there, an opening. So maybe somebody with some type of prosthetic device could actually use it to hook and to steer as well. Um, these are interesting, and so like I mentioned, some of the blinkers, I believe all blinkers actually are on the right-hand side of the vehicle, right? I kind of take that for granted. Or I'm sorry, left-hand side of the vehicle. And so this little piece attaches onto it would be your blinker device and crosses over to the other side of your steering wheel. So if you are simply driving with your right hand, you can use your right hand to just simply flip that lever, and it will actually make your blinkers turn. So you're just using the right side instead of having to use the left side. So here's an individual who has that spinner knob with one hand. The other hand is a push pull hand control, and so that would help accelerate or decelerate your car as well. And so those are a little bit more intense of a modification. Here's a closer picture of it here. So you can see they would need some grasping ability as well, but there is a knob then to kind of take some of that control away from your lower extremity. So I'm thinking of somebody maybe who has bilateral lower extremity amputations or doesn't have control over their lower extremities. Maybe they're paraplegic. So this one is interesting also. This one actually fits onto your accelerator, over your accelerator, and then goes underneath your brake so that you can actually accelerate with your left foot. So if you were non-weight bearing with your right foot and you couldn't access, or maybe you had an amputation and you can't access or you can't cross over those kinds of things with your left lower extremity, they do have this device that attaches onto the accelerator, and you can use that just again with your left foot as opposed to your right. Pedal extenders also. So if somebody maybe is shorter or they need a wider pedal or a longer pedal, there are many different kinds of pedal extenders as well. You can see this one is going right over the brake. There's also one on the accelerator as well to kind of push them out a little bit more or get them closer to somebody's lower extremities if needed. And so again, if they can't reach the pedals or those kinds of things, we can simply add a pedal extender. Here's different eye check mirrors, lane check adapted mirrors, those kinds of things. These are handy. Your eye check mirror is usually placed on the passenger side. And so if a therapist is taking a client out with them on the road and doing more of a specialized driving assessment with them on the road, the therapist could simply put this to kind of view what's going on behind them and kind of get a wider view. The lane changer adapted mirror also is a little bit wider spectrum. And so when it's placed on the rear view mirror or below the rear view mirror, it's something that gives you a little bit wider perspective, especially when you're changing lanes. There can be blind spots, as you probably all know that from personal experience. I know I've tried to change lanes and like, whoa, they were completely in my blind spot. So this just is an adaptation that would help somebody maybe who doesn't have the neck rotation or trunk rotation. There's also the blind spot mirror. I know one of my vehicles that I have at home has this already built into it. I don't know per se if it's exactly helpful, but it can be placed right on your mirror. And so it is supposed to magnify more of the area. I know personally for myself, I have a hard time when I'm driving focusing in on that smaller mirror to see what it is that I'm actually seeing. So it's just a lot easier for me to turn my neck because I have that ability. But again, somebody who doesn't have that ability, this would be something simple for them. Again, here's the lane changer mirror. You can see there the eye check mirror. That one is attached with a suction cup right to the windshield. And then the therapist also has a rear view mirror attached to the lane changer mirror so that when the therapist is sitting in the passenger seat, they can be looking behind them. So a lot of times, maybe you guys remember the driver ed days, right, where you're practicing driving, and then the driver ed teacher is sitting in the passenger seat, and they have the control like over the brake and those kinds of things, and so they can override that. And so some of these adapted cars, or I think all of the adaptive cars, also have that technique just for the therapist safety as well, just in case it's needed. So here's a picture of somebody who has a spinal cord injury. And you can see she has some chest strap to help with her posture. You can kind of see some of the different controls that she has on the left side, on the right side. So she does have use of her shoulders. And so she does have more of those advanced controls. But what I like about this picture is the fact that she does have more of those postural devices, and she is in a wheelchair that is locked into place here in her own vehicle. You can see her here also. So she has a van, and she does have a ramp and a lift. And so she can wheel herself onto the ramp. Actually, I believe it's an electric chair. And then the ramp will lift up. She can go into her van then and secure her wheelchair right behind the driver's seat, and use all of those adapted devices so that she can access her community. Here's the inside of her van also that's been adapted. And so at the very bottom, um, you can see here kind of the hardware that her wheelchair would have to lock into place with. You can see some straps here for a safety belt as well. You can see the steering pin. You can see some of the levers here as well for the signaling, the shifting. And then I believe she does have some of the accelerators here. Yep, right here. Here's her accelerator to push the car, or I mean to push the car, to get the car to stop and to go. And so she has everything accessible to her there. Again, here she is all locked into place, all ready to go, and she can access her community. Here's another person who has more of an electric chair, a little bit newer of an adapted vehicle, certainly, but you can see how she does have use of her left lower extremity. She can reach her steering wheel, and so her adaptations were rather simple with just the left foot accelerator. It looks like there are some pedal extenders too for her, or just even a wedge, a foot wedge, so that she can rest her lower extremity on when using the accelerator and the brake. And again, you can see that she just drives right on in, right on into place, and can secure herself with her safety belt and get on the road. And again, she has a ramp also, so she can drive herself in with her electric chair and transition right into the driver's seat. For some individuals, adapted vehicles, I mean, they range in complexity, they range in price, they can get very, very expensive. But just so you know that they do have seats too that swivel and turn and lower, so then somebody could transfer right into their vehicle, and then it could lift them right up and place them in that driver's seat or passenger seat as well. Here are just a couple other options. So that rear facing, so you could drive or propel yourself right in with your wheelchair and move right into the driver's seat. And then this one is the one below in the car is kind of the one I was talking about, where somebody would actually transfer into their car seat, and then they have kind of a crane that goes around, picks up their chair, and would be able to put that right on top of their car for easy transport. And then when they get out of their car, they would use that crane to kind of lower their chair, and they'd be able to get right in it again. It's very, very, very cool adaptation. So there's a few laws in North Dakota that we just want to review. So there's the licensee law, there's the health and safety law for physicians reporting to the Department of Transportation, there's the seizure law and the visual law. So a licensee must report any permanent loss of hand, arm, foot, leg, or eye to the Department of Transportation before they operate any motor vehicle. Okay, and so this is a law that we all have to abide by people who have driver's license. So if something like this happens, we are responsible to call the Department of Transportation to let them know. A physician may report an individual if there's any reason to believe they're unsafe to operate a motor vehicle. Okay, so that's and the different laws have different sub numbers and numbers, and so don't worry about that. It's more of the awareness that a physician is the one that can, or a physician may report an individual to the Department of Transportation if they feel they're unsafe in any way. The kicker is if a physician doesn't make that recommendation or makes a report in good faith, or does not make a report in good faith, I screwed up the wording here. So a physician who fails to make a report of somebody or makes a report in good faith is not subjected to any liability, criminal or civil case based on that report or based off of that report. Okay, so there is some protection here from physicians or for physicians who do not make that report or make a report saying, hey, they're good because of X, Y, and Z, but then the client goes out and gets in an accident, right? That, well, then that person, there should be some protection for that physician so that person doesn't come back and sue that physician for being liable for that accident. The seizure law, so if a patient has seizures, they must be seizure-free for 3 consecutive months, and they have to have a statement submitted to the director of the Department of Transportation. And so the physician is the one who's going to write that certification that the condition, that their seizures are adequately controlled, and that the person has been episode-free for at least 3 consecutive months. So again, they also have to agree that in their best knowledge that a person who's operating that motor vehicle will not put the public in danger if they get behind a wheel. And so again, that kind of falls on that physician to certify. And again, this is more relating to specifically seizures. If there's a single episode seizure, that sometimes happens, and so the director or the Department of Transportation director considers that the opinion of the treating physician, if the physician were to say, nope, this was a single episode, it is not likely to occur again, and so if they get that documentation, there will not be a 3-month waiting period. For some of the visual laws, we have to have at least a 20/60 visual acuity or less, or if we have 20 or 60 visual acuity or less than that, we must have a road test. And so the Department of Transportation may have restrictions in regard to what visual acuity we have based on just simple corrective lenses, right? And so I was nearsighted for several years before I had LASIK eye surgery. And so I had restriction on my driver's license that basically, like, I can't remember if it was a restriction 1. And that basically just said I had to have my corrective lenses when I was driving. They may have restrictions in place to only drive during daylight hours, and they may actually make recommendations to get visual rechecks as well to kind of follow that visual acuity. Right at the Department of Transportation, they do have that visual field test. And so they'll have you look in the binoculars, right? And then you tell them, okay, do you see the colors on the side? Or tell me where you see the colors, and you kind of tell them, right? Um, and so if your visual field registers greater than 105 degrees, you will not have a visual field restriction, okay? And so 105 degrees is not 180, right? And so there is still a little differentiation there, but it's really important to know that if you have at least 105 degrees, there is no such thing as a visual field restriction. If they do not pass the horizontal visual field, so if they have 105 degrees or less, okay, they will not be issued a license. Okay, so again, there's no restriction in visual field, but they simply will not issue you a driver's license or an operator license to drive a car if you have less than 105 or 105 degrees or less. That's just kind of the wording of our laws here in North Dakota. So when is a professional driving assessment necessary? This might be referring to a driver rehab specialist. So any kind of physical impairment, of course, right? Because there's all kinds of adaptive devices that can be added. There's training that can happen, education that can happen, all those kinds of things that can happen for somebody with a physical impairment to get back on the road again. A cognitive impairment. So it's good to identify, does the person have the potential to access their community and their personal transportation safely, or is it just too great? And so again, a professional driving assessment may help us just kind of differentiate that line if we're not comfortable with our just using our clinical judgment there. Any visual impairment too, it would be a good idea to get a professional driving assessment completed, just because there are different training things we can do with compensation, with the different mirrors, concave, convex mirrors, all those kinds of things that can help perhaps somebody with visual impairment. There's different adaptive devices out there that can also be used to help somebody with lower vision, again, as long as they're within those visual acuity parameters required by the Department of Transportation. If you notice any delayed reaction time, also, that might be indication for, okay, maybe they need a professional driving assessment. Again, is their delayed reaction time too much, or is there anything that can be adapted to help increase that reaction time? If any client is just apprehensive about their ability to drive too, it could be a good idea to refer on to a driving specialist or a driving rehab specialist, just to give them peace of mind and to really do some formal assessments that are more comprehensive in nature. And it might just be, working some of the anxiety out by just knowing that the person sitting next to them has control over the brake, and let's practice and let's go through some of these driving skills to ensure that you're more comfortable about your skills as a driver. If anybody has decreased sensation as well, that kind of especially that diabetic population. They may have some neuropathy in their lower extremities or even their fingertips. But I'm thinking of the times where maybe you don't know how hard to accelerate or to brake. And so, again, with that particular diagnosis, having decreased sensation can be somewhat problematic with the acceleration and the braking and those kinds of things if you can't exactly feel. Driver safety course, aarp.org. There's some really good older driver resources on there. Senior driving at AAA.com. The Hartford Mature Market Excellence. AOTA is also a great resource for you to get other techniques, advice, information about driving rehab, and just helping people access their communities. Any documentation relating to driving that's recommended. So any diagnoses, any functional limitations related to driving. And so even though I myself wasn't working on driving with that individual with a traumatic brain injury, you bet I was documenting that the client missed the curb stop when driving into his appointment today for outpatient therapy, right? Like I was documenting those. I was calling the doctor saying, hey, this person was supposed to get a ride from a public transit because of his disability, and he's showing up here in his pickup truck. I don't like, you need to be aware, right? Providing any patient education you could do also. So sometimes there's just some simple patient education I might be able to do in my type of outpatient setting where you're just working on transfers, where maybe I'm having a patient and I'm teaching them some adaptive compensatory strategies to scan a little bit more. So I certainly feel comfortable with those kinds of things, and just even educating your client on driver rehab and that there's specialists out there and the benefits of accessing those specialties. Referring to other medical specialties as well. So I'm thinking physical therapy is a good one, just to look at strength, endurance, range of motion of the lower extremities, sensation with the lower extremities, those kinds of things. Referring to a driving program, right, or a Department of Transportation. And maybe even just recommendations, again, directly relating to driving. So it wasn't uncommon for me in an outpatient facility where my clients come to me to have conversations with them relating to, okay, I'm recommending you come to therapy 2 times per week to work on, your hands or your hand or your wrist. How are you going to get here? Is it feasible for you to get here? Okay. Do you have family who can bring you? Are you open to using public transportation? Can I help you get a ticket or a pass so that you can come to your therapy appointments? Okay, and so it wasn't uncommon for me to make some of those recommendations directly relating to driving or using public transportation so they could access the services I had for them. So that's good to keep in mind also. Appropriate referrals for driving evaluations. So when, again, in my practice, when somebody really wanted to get behind the wheel and I felt like it was possible with some adaptations, or even if I was just kind of scratching my head questioning, I wonder if this client would be safe. I'm kind of questioning based on my cognition assessments, based on my strength assessments, based on all my other assessments. I think I need to refer on to a driving rehab specialist. And so that's when I would make my call to some people I knew here in Bismarck. Making sure the client's meeting the state laws. And so ironically, I had a friend who had a foot surgery who was non-weight bearing. The doctor said, okay, you should not be driving. But our state law states, okay, you can actually drive with your left foot um, if need be. And so there's no additional test you need to do through the Department of Transportation. If my friend would have gotten pulled over and they saw the big cast on their right foot, and they were using their left foot to speed and or to accelerate and to brake, and the sheriff pulled him over, they could not cite him for that. And so it's good to know what your state laws are, and that individual who was driving with his license being suspended, those kinds of things, making sure that I'm documenting that. And we really question, like, should we be calling the police? I mean, we called the doctor, we referred on to the doctor, we gave him referrals for public transit, all those kinds of things. General knowledge about what the patient has. Do they have a van? Do they have a car? I think that's really important too, knowing, are they looking at getting a whole new system? Are they going to need a whole new system? Is that even feasible for them? All those things are important considerations to make, especially when working with a driver rehab specialist, and making sure your referrals are timely. And so, somebody who just gets home from a rehab hospital and they're just working on um, accessing their own home, right? That may be too soon to say, hey, let's get them into driver rehab, because it may increase their risk of failure, right? They're not confident in their seating system. They're not confident with their independent transfers, those kinds of things. And so let's work on some of those things in rehab in our outpatient type of setting. However, we don't want to let it go too far, because the longer they go without sitting behind the wheel, their confidence is going to decrease. And then they may have additional problems with Department of Transportation issues as well, with suspending licenses and testing and all of those kinds of things. And so just make sure, again, that when we do cross refer maybe to a driver specialist or maybe even another specialist, that what information we have about their current function, maybe about our concerns, maybe about what their vehicle is or their plan for acquiring a vehicle, will help them get off on a very timely, efficient, thorough driver rehab evaluation. So referring to other agencies, AARP has a safe driving class. That's really good for individuals. There's certain driving schools too. Adult learning centers have access perhaps to that driver's education, those kinds of things. Department of Transportation also has some really good, they've been really good to work with. Believe it or not, they've been really good, again, really good to work with. I know the driver rehab specialists here work directly with the director of Department of Transportation. And so anytime they're adding adapted devices or anytime they're running through certain standardized testing procedures, those kinds of things, they're in communication with that Department of Transportation, and making sure they're meeting that Department of Transportation's guidelines. Certain types of vans, again, there may be some type of evaluation driving programs out there, because adapted vans, they're getting to be more common actually, and so there's different programs that look specifically at vans. And so just some statistics here that I updated. In 2017, 44 million people over the age of 65 have driver's license. And so I see I put 44 million people twice there. That's a 66% increase since the year 1999. So our older adult population is really going to exponentially explode here, and we're going to see older drivers on the road. Again, the number of Americans age 65 plus is expected to double since the year 2010 by the year 2050. So it's projected to be 88.5 million people. And so again, we're going to see people with those typical older adult changes, with the decreased range of motion, the decreased response times, those kinds of things. But ironically, the older population is noted to be safer drivers. And so just because they have those age-related changes in vision, response speed, range of motion, those kinds of things, they've actually been dubbed as a safer driver. However, if they do get in an accident, that risk of injury and death increases as that person's age increases. And so they just become more medically frail, right? And what accidents they do have tend to be more fatal. And so we want to keep these drivers as safe as possible while they're on the road. Here's a great CDC website for some updated motor vehicle safety, particularly of that older population or older drivers, for you to kind of explore. Some other things before I get into the sources that I wanted to mention relating to community mobility. It's not uncommon for people who reach a certain age to become shut in. I think a lot of people, when you go on your level 1 fieldworks and you're accessing assisted living facilities, there are people that don't ever leave their apartment. They don't ever get out. They don't ever socialize. And so that leads to issues with depression. That leads to issues with social isolation. That leads to issues accessing healthcare. That leads to issues accessing food sources and healthy foods and those kinds of things. And so just think of the impact it has on individuals when they lose their independence with driving or even accessing their own personal transportation. And, I remember when I received my driver's license, like, wow, I'm free, right? And now think of what that would be like to get that taken away from you because you've reached a certain age. You've been independent driving for 60 years and now you get that taken away from you. What difficulty that would be for some individuals. Now, I did a little research here on the different credentialing that you could get being a certified driver rehabilitation specialist. This is the CDRS credential, so those initials will go after your name. This is the gold star of driver rehabilitation specialists, okay? And so both of these credentials are given to you by the Association for Driver Rehab Specialists. So it's its own site. I included the link there if anybody's interested. They have online education, they have certification education, they have how to reapply for your credentialing. Each requires certifications through various numbers of coursework. And your continuing education, so once you achieve that credentialing, you're going to have to continue with that level of education. And so I know for the CDRS, you have 30 hours of continuing education in driver rehab to accomplish in 3 years, okay? I'm not sure what it is for the driver rehab specialist, but I also know for the CDRS, you have to have so many practice hours per year, I believe it is, to maintain that credentialing as well. Okay, so again, the CDRS is kind of that gold standard. Sometimes I think of working in a rural setting. I didn't always have access to that many people with that one condition. And so perhaps the driver rehab specialist would have been something that I could have attained with some education and some kind of certification course also in that area. There are exams that you may have to take. I know the CDRS, there is an exam that you have to take in order to earn that credentialing as well. And I believe I saw it was like $550 just to take that exam. Something that I used to do also was through AARP, and it was called CarFit. And so it's a training that you can go through as a therapist, and you learn how to um, measure, directly position people's mirrors, right? To help people with transfers. How far away are you supposed to get from your foot pedals, some very simple things that you can do. There's different community outreach ideas where you can have a car fit day and you can have people for free come to you and you can do a quick car fit screening with them and test out different things. And so AOTA puts one on or promotes car fit as well. I went to car-fit.org for more information there as well. Again, that's a simple training that you can do on your own. Again, not having to be CDRS or DRS certified, but it would certainly give you some good tools in your toolbox to at least address or start looking at some driving if that interests you. Here are some great references. Again, I pulled a lot from our driving rehab specialists from our community here. And so they certainly helped out. Your Trombley or Bonder, I'm sorry, there's so many books. Your Bonder text, I was really surprised at the usable items that are in there. So please take a look at that as well. So again, here are some references for you, very specific to driving that are certainly worth looking into. So this concludes our lecture on driver rehab. You will have to, unfortunately, well, I don't know if it's unfortunate, I think it's fortunate, but hopefully after this lecture, you'll kind of be able to finish up your assignment on community mobility, community participation. Okay, this would be concluding your driver rehab portion. I expect that you will research on your own some adaptive devices that could be added based on whether it be a physical condition, a cognitive condition, and it will require you to explore some of these resources that I've shared with you today in order for you to complete the assignment. Thank you for your time and your patience. And if you have any questions about driver rehab, I would be happy to answer in which way that I can or in any way that I can. And if I can't answer it for you, I would be happy to reach out to any of these individuals to make sure that you get any information you need. Thank you so much.